Welcome back to Beyond the Prescription podcast. Today we are interviewing Sara Buckels here in Olney. She is a licensed massage therapist. She actually helps treat a wide variety of diagnoses related to people's health, and we're going to dive in deep to that today. So welcome, Sara.
Hello.
I'm so glad you're here.
Thanks for having me.
So you are from Olney?
Yes.
Awesome.
Born and raised.
Born and raised. Mm-hmm. Okay, very good. You've got some kiddos?
Yes, a 16 and 11-year-old. Fun age.
Very good. And you have your own kind of, I was going to say practice. That's what we call it in the medical world. Okay. Just down the road from here, from Thrive.
Yes, I just moved into, this is my third location. So I started out in a itty tiny bitty room at the gym, grew that space, went into another bigger space, and now I have my own building.
Oh, yay. Very good.
All by myself.
Very good.
Yes.
So you are a licensed massage therapist.
Yes.
Okay. And I personally came to you because just probably overtraining and, not stretching enough and doing all that stuff. And then I get all balled up and I'm like, Sara, please help me. So you've helped me a lot with that. And I just want to dig into, because this is a great resource for our community, for not only you, but other licensed massage therapists to treat athletes, to treat chronic, pain diagnoses, things like that. So I wanted to dig in on what all you do, what all is available, what you've seen work for patients, what you've seen not work for patients, and kind of like what is the best overall, moving forward, that advice that you can give out to people for their health. So let's dig into just what is massage therapy.
So massage therapy is the soft tissue. We're moving and kneading and doing different things with the soft tissue. So our muscles and fascia and tendons.
Let's talk about fascia.
Fascia is, how I describe it, is a spider web.
Okay.
Like a connective tissue. It's a connective tissue is what it is. And so it actually covers everything. Our organs, our muscles, everything in our body.
Okay. So that is something that, isn't really talked a lot about, but it actually has a lot to do with our muscles, right?
Yes.
And our tendons. So, and then, so the muscles, the soft tissue, and then the fascia, and then you said tendons, like tendons and ligaments. Let's go over that.
So our tendons and ligaments are what's going to hold our muscles to our bony landmarks normally and surround those areas.
Mm-hmm. And you see a lot of problems related to those. Yeah. What do you see primarily?
Tennis elbow, golfer's elbow, tendonitis, the Achilles runners have a lot of Achilles issues. Those with plantar fasciitis. The Achilles tendon is normally pretty tight going into the calf.
Yeah.
And pulling on those plantars.
Yeah. So people come to you normally, what brings them in the door?
Pain.
Yeah.
The number one thing is pain.
Okay. So you're seeing everyone from maybe work-related injuries, overuse injuries to athletes, right? Yeah.
Yes. And then pain management.
Pain management.
Normally, those who work the same, repetitive job.
Mm-hmm. Factory workers,
or those who just live in pain due to other medical issues.
So let's just kind of dive into athletes. You said Achilles, and then, you have the golfers or the tennis elbow. Is there a certain age group, let's say millennials? Here we are. What is the kind of the number one that you see?
Well, actually, it's funny. I just had this conversation. younger kids are coming in. Parents, us millennials, are working on making sure our kids are getting taken care of at a younger age. So
That's good.
A few weeks ago, I actually saw a 6 and 8-year-old who are into tumbling, softball, swim. So yeah, their mom comes for, regular maintenance. And she's like, the girls are complaining about this and that. Do you think I'm crazy for trying to get them in and seeing them? And their shoulders from swim and gymnastics were kind of balled up. So they were in pain. They had some pain from repetitive motions that they've been doing and using. And then I have a 10 or 11-year-old that comes every once in a while due to the sports that he's in, and just a maintenance. And then I do see most of the high school. I mean, I would say high school age is when I normally start seeing. But here within the last 6 months, I've actually been seeing younger children.
Yeah. Whenever like a high schooler comes to you and they are coming into you with maybe some shoulder pain or whatever it may be, like what does that entail for a massage therapist? How do you assess that?
I normally ask like where the pain starts, or is it in their trap? Is it in their delts type area first? And then is it radiating anywhere? Is there any referred pain elsewhere? Like when do they see it? When do they notice it? Is it when they're in the gym conditioning? Is it at practice if they're baseball swinging or throwing, or that's where I start. And I'll ask those type of questions. Then I'll palpate the muscles, see what's going on. Again, with the fascia, that's where I normally feel the knots. Okay. And that's normally where our knots are coming from, is the fascia's getting balled up. So then I'll kind of work on that area, and I'll ask questions again. Is there any numbness, tingling, seeing if there's a nerve, like impingement underneath that area? If it's, say, in the delt, are you feeling that? Is it coming over to your pec? Is it going down into the bicep? Just kind of see where things are leading to, or if it's just in that central location. And then we may just work on that central location. I may pull out tools. I may grab cups if I need to. That's going to bring the blood flow instantly, depending on what cup I use. If I use a static cup, we're using a pump. It's pulling, the tissues up around the knot and getting blood flow coming fast, and you get those purplish red,
So whenever you say cup, explain to like our listeners, like a cup as in like cupping, like what they've...
Yeah, cupping therapy. It's an instrument or a tool, basically. And they have a static cup, which is, comes with a pump, and it's a hard plastic. Normally, they do have glass ones. I just use hard plastic ones. And we put it over an area of interest, whether it is normally a big knot or big fascia. And normally that's either a recent injury, or it's repetitiveness and it's just balled up. And I mean, if it's repetitiveness, it's really never really going to go away. But by doing the massage and the cupping, we're getting blood flow, extra blood flow and oxygen to that area to help, regulate and get, better, whether it's range of motion, if it's sticking because of range of motion or what's going on. And so the cup, then a static cup, we use a pump and we pull it up, and it normally changes colors instantly. And those I leave on there just minute. We just want blood flow. That's really what we're doing, is we're getting blood flow to that area because there's been restriction there for a while. Then we have silicone cups as well, and those are gliding cups. So I can use those as a tool other than my hands as well.
Okay.
And it's going to bring more blood flow with the cup because it is suctioning just enough tissue up, where my hands, I'm going to have to dig deeper in there to get blood flow.
So the cup is like helping like move up the fascia, like from the muscle, right? And that's kind of where the blood flow can kind of come into the area. So if you have pain, bringing in the blood flow, obviously that helps with all of that. I remember I had cupping one time. I was having problems with my back, but they used like, I think it was a match. Does that sound right?
Oh,
like with
yes.
a glass?
So in Illinois, we cannot use.
Okay,
I don't know.
it was in Indiana.
Okay. Yeah. So each state has governing laws for each profession and what they can and can't do. So yeah, those are fire cups. I've never used them. I don't know if I would even trust myself.
But she put a match in the cup, and then it like went out, and then it just like
so that it sucks up. Mm-hmm. Yeah. So when they do that, I think the air in that, and then they put it on there, and it like sucks up, and then the heat. Yeah. It's extra heat to that area
to help with it. Okay. Yeah. That's the only time I've ever had cupping.
That's interesting. I would like to just try it myself to say I had it done, but yeah, I mean, we can't do certain
things in Illinois.
Yeah. Mm-hmm.
Cupping is from like Eastern medicine, correct?
Yes. Yeah, Chinese. Yeah, it was a Chinese medicine, and I think at first they used horns and stuff from the class that I took, and it was insect bites and stuff, and they were pulling like stuff.
The toxin
the toxin out.
Okay.
Yeah.
And because it's been around a long time.
It has, yeah.
But to me, like, I feel like we're seeing it more. Like, you'll be watching something sports on TV.
Michael Phelps with those. Those were that's when it became very popular.
Yeah. Yeah, I think cupping is a wonderful resource for chronic pain or injuries, things like that, because you can actually accelerate the healing process.
Mm-hmm.
So.
Yes, it gets the lymph kind of moving as well, the lymphatic system as well, depending on if you're around those lymph nodes, and just kind of starts the process a little early, I guess, or faster.
Mm-hmm. And with your athletes, you also do like some stretching techniques too.
Yeah, so Thai, yoga Thai is what it's called. That's my training. And I do more of the stretching than I actually do, I feel like, the Thai work. Because the Thai work is a lot of compression and just giving space around attachments, the ligaments, and just attachments to where things attach on the bony landmarks and stuff. But the stretching, because I don't practice what I preach and I don't stretch like I should. So I incorporate a lot of that, either on the table or on my mat. And honestly, if someone else is stretching you, you're going to get a better stretch.
Yeah, I remember like whenever you were
your
stretching me.
And IT band, yes.
I was like, this hurts so good.
Before coming down here, I had a client, and this was her first time massage, and we did that, and she's like, oh my goodness. I'm like, breathe.
You can tell that it's actually doing what it's supposed to do to your, hamstrings, or for me, or whatever it may be. So it's pretty good stuff. So let's talk about pain management. Whenever we talk about pain management, there's a lot of people who suffer from chronic pain. And thankfully, society, we're moving away from using a lot of narcotics and things like that to just mask the pain, and we're actually treating the pain. So tell me an example, or if you can share, of a case that you treat for pain management.
So I see a lot of fibromyalgia, and one in particular case is ME. And this client lives in chronic pain all the time. It takes over everything, as in like brain fog, and her joints, like she can get bedridden a lot of times. So she actually comes regularly. She is my longest, I guess, session patient, you could say. And we normally do 2-hour sessions.
Wow. Okay.
And every treatment is different. It's not the same, because it just depends on what kind of pain and where it's kind of attacking her body each week.
So whenever somebody comes in, you're doing the pain management, you're going to be using the same treatment as like you would like an athlete, or what does that look like?
It just depends on the day. So say, let's go with the ME patient, per se. She may have total pressure like just all over head pressure, headaches, migraines going on. So a lot of that is going to be neck and shoulder work. We're going to kind of get all the tension that's going on around the occipital. We may do a little bit of, getting some cranial, just pressure, tension release. And then a lot of it's going to be in her neck and shoulders and even in the chest area. So I'm going to focus a lot on that. Probably if there's a lot of tension, I'm going to normally cup traps, shoulder area, and then do some like myofascial release, kind of push and pull, kind of get the shoulders to work and move, have more movement along with the neck. So a lot of myofascial release into the traps and upper chest.
Okay. So explain to us about how, like with headaches and what is going on with your neck a lot of the times, because you probably have a lot of headache patients.
Yes, a lot of is tension headaches. So what do we do in our society right now? We are looking down, right, at everything, whether also if you're sitting at a computer and just bad posture. So a lot of that is going to be tension, and it's going to start normally at the back. Sometimes it is TMJ as well, and it's those who have teeth grinding issues at night. And so they grind, and their TMJ from the dysfunction of the grinding is causing and pulling tension, and then on the neck and shoulders then.
And so they just kind of just have, one-sided or?
A lot is normally one side is worse. Okay. I will say that. But sometimes it's equally both. Or maybe because the one side they grind at night hurts, they're chewing on the opposite side. So all of that is just tight.
So you can do treatments like with the TMJ, with your joint here, up here?
Yeah. So I just, a lot of times it's just massaging and holding and compression, having them open up their mouth. There are, I've never taken courses, but there are actual like intro where you can massage the inside as well. I'm not a dental hygienist, so I'm not sticking my fingers in someone's mouth.
Open up.
Yeah. But I will give them those I can look up those techniques and be like, when you're at home, do these yourself.
You can do them yourself. Yeah. Because TMJ is actually pretty severe for a lot of patients.
Yes.
So, and I'm pretty sure even after sometimes they have the release, even if they go into surgery and have the release, they can still have issues with it.
There has been one lady, and she said she's had the release, but she wears her night guard. She still has to wear a night guard even after the surgery. And a lot of times she'll just be like, can you work on those areas for me? And we'll do, a good amount of time on those areas just to get the pressure.
So with the tension headaches and things, stress, we often carry that. You can feel I guess you were talking earlier about the knots, could per se, of the fascia. So we see that, you see that a lot.
Yes.
In the upper back, neck?
Yes, a lot of that is in the traps, neck area, for sure, as of knots. Most of lower is going to be those who overtrain. Most of the time I see knots is, those who overtrain with athletes or, just injuries in general, like past injuries.
Whenever do you develop a treatment plan for patients? Like let's say, I came to you for my right hip. What's going to be the treatment plan for, are you going to give a treatment plan for the patients? Are you just going to go each appointment by appointment? How does that work for them?
I don't technically per se say that I make a treatment plan. We kind of work through it. I guess I probably should. We do, but we don't. I don't say we're going to see you X amount of time or 3 times this week and that. A lot of times most of my clients are already regulars, so we just work on that focus area until it's either they're seeing improvement. I may change up what I use. I'm always asking, how did you feel after last session? Did you get more relief because we used this or we did this treatment for that hip issue, or the first treatment. Like, we'll go back and forth and try to like figure out where the benefit is coming and where they're getting more either range of relief or range of motion, or where they're seeing when they're back out doing what they're, their regular lifestyle.
Do you feel like there is a preventative place for you and like what you do for patients? Like, as in athletes or anybody, like as you get older, is there preventative, like treatments from you could help prevent certain injuries and things?
Preventative is just movement of the body, to be honest. And yes, I mean, if you are doing repetitiveness constantly, say the same job, or those who are in, sports, and they're, they start at a young age up till, high school, college level even, massage is going to help with the soft tissue. But having a good workout plan and mobility and stretching regimen, and that's for anyone, honestly, not just athletes or those who are doing repetitiveness all the time. Longevity is gonna be great for you.
Do you have very many geriatric patients?
I don't.
Yeah.
I really don't at this point in time.
But they could really benefit from it.
But yes. Yeah. Especially those, I guess, post-surgical. That would be a big, for the older patients after surgery, scar tissue release, things like that. Massage would definitely benefit in getting them back on the right track after something like that. Or even, I feel like I have too much of a heavy hand to probably have too many geriatric patients, because I like to, make people squeal a little bit.
Because you're putting in all that pressure.
I'm putting too much pressure in. But light touch would definitely benefit those of that.
What you do is, whenever we say licensed massage therapist, there is an aspect of the relaxation, the stress release, but a lot of what you do is more of, treatment.
Yes.
So instead of like going to necessarily like a spa, you're doing like, hey, let's treat your pain. Let's help you, help your soft tissue. Let's help prevent further injury. Where you do have the aspect of the stress management incorporated with that, but a lot of yours is for pain management, athlete repair, or athletic repair, muscle repair, things like that.
Yeah, exactly. Treatment, I guess. I feel like that's probably what everyone normally comes for, is some kind of treatment or some kind of plan of care for whatever it may be for their lifestyle. Because,
with the geriatrics, like what you were talking about, the mobility, that starts to decline, earlier in life than we even think about, like your back, your hips, your shoulders. I even know, like with diabetics, you can get just like frozen shoulder syndrome. And I don't know.
Then I just had someone call me, and I didn't know this, that during perimenopause and menopause for women, certain women, frozen shoulder. Is that? Yeah. I haven't done my research yet on that. I was like, I am going to have to look into that. But she had called and was like, I'm trying to get on top of this because my other one did it. And now I'm from this part of this stage to this. And I was like, oh, wow, I did not realize that.
One thing that a lot of people, or that we see in healthcare, is back pain. So what do you see in your line?
A lot of, I do have people come in for back pain, and a lot of it's post-surgical lumbar issues afterwards. And I feel like it's the scar tissue area. And that's the releasing scar tissue and stuff. I've had a few fusions. Most of it's like stuff that's been cleaned up and around, whether it's bone spurs or things, I'm guessing like that surgically, that they've went in there and cleaned up, or maybe herniated disc. And it was causing uncomfortable sciatic pain. So sciatic pain is always, which sometimes is piriformis syndrome, which is that little muscle in the glutes that's hidden underneath all those, the bigger glute muscles, and that gets tight and taut, and then it pushes up on that sciatic.
Okay.
And so stretching that area and just releasing the tight muscles of the glute muscles. Sometimes, not all the time. If it is true as piriformis, a lot of times, it just working to make that stronger.
So whenever you're talking about post, like, op, you're not talking like brand new post-op. You're talking like they've recovered, all this stuff, and for some reason they're still having some problems back there.
Yes. Okay. I had a client come in probably 2 years after her back surgery, and it was starting to get uncomfortable, and that again, she went back to her surgeon, and they said everything looked great. They did new imaging, things like that. Everything looked great. And so she reached out, and then she ended up sending me her aunt as well. Like 2 or 3 years later, she had the same issue post-op, and I think it was just more of the scar tissue around the lumbar area from the incisions and that. And you think about it, your low back, I mean, how are you going to get in there and release a lot of that, you know? And I'm sure that they both live pretty sedentary lives. So foam rolling and things like that, I don't think would have been on their nature to try at first. And so just getting in there, releasing those areas and the muscles, like the QL muscle and things in those areas, seem to help ease the pain.
Do you see a correlation with the quality of life as, you know, people are getting older with their activity level in patients? So like you said, sedentary life versus you know, people who are remain super active.
Actually, yes. So those who are more active, I mean, they do have a better quality of life. They are, some people, I wouldn't guess their age that come in because of, and then I have those who retirement, so recently retired, who she wanted to figure out how to be more mobile. Hard getting up off the floor with her grandkids. And she's like, well, I just don't understand because genetics isn't it. My mom is 80-some years old, and she can push mow. She can do this. So I said, well, what have you been doing since you retired? Sitting in my chair.
Yeah.
Well, let's get out moving. Let's, find some kind of exercise that you like. Silver Sneakers here in town. We have 2 yoga studios that have, one has chair. I didn't know that. I just learned this recently. They have chair yoga for those who are just getting introduced into that. So something like that can get her up and moving and mobility. And that will help. Or getting up and off the floor every day.
Yeah. Just doing it. Yeah.
And so to hear her say, my quality of life, I don't know, but I thought I'd be better because my mom is out doing this. Well, what has your mom always done?
Kept
moving. She did have, her job. She said, my mom did this for years, and I sat at a desk for years, and now, so yeah.
So whenever you're active and in sports and still doing different trainings and things, you can have, those localized injuries, but usually with time and, treatment, it gets better compared to if you live a sedentary life. It's almost like your whole body.
You lose it, and once you stop using it, you lose it all.
Yeah. So even though, runners may get some arthritis in their knee, overall, they have a better quality of life as they age. Or people who do strength training, they might strain a muscle here and there, but overall,
tears and things like that.
They're going to be able to, their longevity of life as they age and their movement is going to be better.
And their healthy lifestyle. I think those who stay active, they seem to have a better quality of diet.
That's true. That is true, too.
Then, years ago when I worked at a desk, I felt like I ate to kill boredom in between things that I did at that job, and now it's like I eat my 3 meals a day. I don't snack all day long, and I'm busy and up and moving, and it does. It takes a toll on your body once you stop too. I've done that. I've stopped, thought, oh, well, what I do is so physically demanding that, oh, I don't need to work out anymore. And I took, a year break, and I was like, oh my goodness. Like, I was in more pain after working all week compared to getting up at 5 a.m. again and start doing something and moving my body.
Makes a big difference.
It does make a big difference.
So if you had to leave one thing for our community, something, that is near and dear to your heart on why you do what you do, or just one piece of advice that you could leave for our listeners, what would it be?
I love what I do because I get to help others create a healthy lifestyle for them or a treatment plan to see them overcome an obstacle.
To get back.
To get back to where they were before, or at least on the right track for that.
Awesome. Well, thank you for what you do for our community. Thank you what you've done for me. So you've helped me. I was running a marathon, and I knew I wasn't going to be able to get to that finish line if I didn't get some work done. So you helped me with that. And I hope people come visit you at your little spot here on Whittle, right?
Yes, 313 South Whittle Avenue, right next door to Pizza Fest.
Oh, very good. So thank you so much, Sara, for joining. I hope you guys can take away things that you need to do for your health, for your muscles, for your soft tissue. So you can find Sara on Facebook or Massage Books at her booking app, and she is here to help you to continue to thrive.